Hi everyone, we are dental hygiene students from Niagara College, currently in the final term of our program, and we are so excited to be here with you today. We are proud to be providing care to our patients at our on-campus dental clinic located at the Welling campus. Our dental clinic offers both preventative and restorative treatments to all members of the community. You can find a full list of services we provide by scanning our QR code. We would love for you to take a look. Throughout the program, we've also had the opportunity to provide care at long-term care homes across Welland, offering hands-on support to residents and helping meet their oral health needs. Today, myself, Christina, Javiera, Mac, and Caitlin are here to speak to you about the importance of oral care for your patients. Oral hygiene plays a critical role in maintaining overall health. Patients and residents rely on your support to maintain good oral hygiene, and that support makes a real difference in their well-being. So thank you for being here today, and please enjoy. Dental plaque, also known as dental biofilm, is a soft, transparent, sticky layer of bacteria that begins forming on the surfaces of our teeth and throughout our mouth within seconds. So it's completely normal. Everyone has plaque in their mouth. And because it's constantly forming, it needs to be effectively and consistently removed through good oral hygiene. Even with healthy habits, plaque continues to build up over the course of the day. That's why brushing just once daily isn't enough. To manage plaque properly, it's important to brush twice daily in the morning and before bed. Along with brushing 2 times a day, it is very important that we're using proper brushing technique, making sure all of the surfaces of the teeth are not being missed, including the gum line and in between the teeth. With consistent care and proper technique, you can effectively manage plaque buildup and keep your mouth clean and healthy. So as we learned, the very first stage of plaque forms within seconds. It appears clear and sticky, and in this stage, it's fairly easy to remove with regular brushing and flossing. But if it is not properly cleaned away, plaque starts to build up, and so then it becomes more thicker, it can have a more yellowish hue to it, and it can begin to look like cottage cheese in texture. So once it reaches this stage, it becomes more difficult to remove. But with consistent and thorough daily brushing, it's possible to clean off. It's just a bit harder than the very first stage. However, if plaque is left on the surface for too long after the first and second stage, it can begin to harden into tartar. So tartar is more stubborn. It bonds tightly to the tooth surface and can't be removed at home with just daily brushing. At this point, it requires a professional cleaning by a dental hygienist or a dentist. This progression is why it's so important to stay on top of your daily oral hygiene routine. Like I mentioned in the previous slide, when dental plaque first forms, it can be very difficult to see because it starts off as a transparent layer that sticks to the surfaces of the teeth. In the dental office, we use a product called disclosing agent. So this helps us identify areas of plaque that is most commonly missed during brushing. So on the left-hand side of this picture, you can see what appears to be clean teeth. But when you look at the right-hand side, after applying the disclosing agent, you can see variations of purple. So this shows us where plaque is mostly left and is still present. This is a really useful tool for our patients because it helps highlight how easy it is to miss certain areas, especially around the gum line, between the teeth, and along the back molars. Even if we think we've brushed thoroughly, sometimes things can be left behind. That's why it's very important to use proper brushing technique and be thorough with our oral hygiene. Dental plaque can form on any surface of the teeth, but it is most commonly found along the gum line and in between the teeth, in areas that are often hard to clean. It tends to build up more on the upper and lower back molars and on the tongue side of the lower teeth. This is because of the location of the salivary glands. So saliva plays a very important role because these areas can contribute to higher accumulation of bacteria, which increases the likelihood of plaque buildup. So that's why it's very important we pay extra attention to these spots while brushing and focus on common trouble areas along with the right technique. So this helps ensure effective plaque removal and supports overall oral. So, as we learned, the early stages of plaque are typically harmless if they are removed properly and consistently through brushing and flossing. But when plaque is left untreated, it doesn't just sit harmlessly on the teeth. Over time, it begins to contribute to a number of oral complications. So some areas that can be affected are the gums. When plaque tends to accumulate along the gum line and isn't removed properly, the bacteria within the plaque can cause the gums to become inflamed. And over time, this can lead to redness, swelling, bleeding, and tenderness. And eventually, if left long enough, it can cause infection of the gums and surrounding tissues. This is why it's very important to not just brush our teeth, but also be persistent in brushing our gums and paying more attention to our gums. Another factor that plaque plays in is the development of cavities. So bacteria uses sugars and carbohydrates that we eat and we digest, and they produce acids. And when the plaque sits on the outer surface of our teeth, it can wear down our enamel, which is the protective layer of our teeth. And over time, this can progress into tooth decay. And if the cavities are left untreated for a long period of time, you may require more intensive oral treatment like fillings and root canals and stuff like that. This is why it's very important in maintaining good oral hygiene so we can remove that plaque before it gets to its hardened stage, the stage we call tartar. So this can significantly reduce the risk of gum disease and cavities, and by removing it, we can better support our overall oral health. Plaque doesn't just affect natural teeth, it can also form on partial and full dentures and cause complications if not removed properly. Plaque can develop around, underneath, and on the tissue side of dentures where they sit directly against the gums. Plaque bacteria can also tend to collect around the clasps of partial dentures and other dental appliances like crowns and bridges. This is because these areas are difficult to clean, making them really good areas for plaque buildup to sit. Along with plaque bacteria on partial and full dentures, food particles can get trapped underneath the partial and the full dentures and can lead to more plaque accumulation over time. Like mentioned in the previous slide, just like natural teeth, if the plaque bacteria is not removed, it can harden into tartar on or underneath these dentures, which makes it even more difficult to clean, and often it will require a professional removal. So this can cause a number of issues with the dentures, including the dentures to get damaged, gum irritation, bad breath, and in some cases, it can lead to oral infections that we'll go on to later in the presentation. This is why it's very important to take care of our dentures and clean them just as if they are natural teeth.
So the next topic we're going to be discussing is very important, just because you guys as PSWs and PNs will be dealing with a population who may have more complex health medical histories. So the oral systemic link refers to the connection between oral health and oral systemic health. So bacteria from the mouth, especially in the presence of gum disease, which is also known as periodontal disease, can enter the bloodstream. This can trigger the body's inflammatory response and can contribute to or worsen various health conditions. So cardiovascular is one of the bigger conditions that can be associated with our oral health. This one's important because we see a lot of patients who present with cardiovascular disease, so it's very important to educate them on how this can affect their disease further. So gum disease has been associated with an increased risk of heart attack, stroke, and clogged arteries due to inflammation and bacteria entering the bloodstream. The oral bacteria that has been found in arterial plaque are known as Purphomonas, gingivalis, and Streptococcus. So in these two pictures, it just shows the plaque buildup that has been caused from these bacterias, and then this is what will prevent blood flow from streaming through the arteries. Diabetes is also another common disease that many individuals present with. So if your diabetes is not under control, you are more likely to develop problems in your mouth. Gum disease may also make your blood sugar harder to control. It is very important to educate patients with diabetes about the value of early intervention in maintaining their oral health. Diabetes can also impair someone's ability to heal, making individuals more susceptible to infection, including periodontal disease. So by encouraging an early intervention and regular dental visits and cleanings with hygienists, we can help reduce the risk of gum disease and prevent the deterioration of the supporting structures of the teeth. Early detection is always our main goal, and consistent oral hygiene practices are essential in managing both oral and systemic complications of diabetes. Respiratory infections is another health condition that we see commonly, especially in more vulnerable populations such as elderly, hospitalized patients, or individuals with chronic illnesses. So bacteria from the mouth can be inhaled into the lungs, which increases the risk of infections such as pneumonia, bronchitis, and worsening conditions like COPD. LTC facilities are very at a higher risk to these infections just because the decreased mobility and difficulty performing oral hygiene themselves. So these are just a few other conditions that can be linked to oral health. So here we have pregnancy complications. Gum disease has been linked to premature birth and low birth weight. We also have Alzheimer's disease and dementia. So research suggests that chronic gum inflammation may be linked to an increased risk of cognitive decline. Cancer risk, so poor oral health, particularly when combined with smoking or alcohol use, can increase the risk of oral cancer. Gum disease has also been linked in studies to other cancers such as pancreatic and lung cancer. And then the last one is osteoporosis and bone health. So weakening of the bone, including the jawbone, can lead to tooth loss and poor support for the teeth, while gum disease can speed up the process of the bone loss. So oral health and its importance to you. So as PNs and PSWs, you may be the first to notice any changes in a client's mouth, such as bad breath, bleeding gums, oral sores or infection, and refusal to eat due to mouth discomfort. So because you work so closely with these patients, it's very important to assess the oral cavity during any daily care and health checks. Early detection and proper oral care can prevent serious health complications. It's also very important to monitor any oral side effects of medication such as dry mouth and fungal infection. And overall, just support better outcomes, client comfort, and quality of life.
Why is oral hygiene important? Maintaining good oral hygiene is more than just having a clean mouth. It's a key part of your overall health and well-being. As healthcare providers, especially personal support workers and practical nurses, understanding the importance of oral hygiene is essential. It not only supports your own personal health, but also allows you to provide better, more comprehensive care to your patients. The most effective way to remove biofilm from the teeth is by using something that we call the modified Bass technique. This method involves brushing at a 45-degree angle with the toothbrush bristles angled toward the gum line, the area where plaque tends to build up the most. By doing this, the bristles can effectively reach under the gum line and along the tooth surface to disrupt and remove plaque, all while minimizing the risk of damaging the gums. It is a simple but powerful technique for maintaining optimal oral hygiene. This slide goes over the steps of the brushing technique, breaking down exactly how to brush effectively.
Manual dexterity and limited gum recession. The brush is placed at a 45-degree angle onto the front surface of the teeth, with the bristles projecting into the pocket surrounding the tooth. A small circular motion is made with the bristles into the pocket. Then, the bristles are swept from the gum line to the biting surface of the tooth, brushing over the entire front surface. This technique is then completed on the inside surfaces of the teeth. The toothbrush is once again placed into the pocket at a 45-degree angle, completing small circles, then brushed from the gum line to the biting surface of the tooth.
You are probably wondering why we recommend brushing at a 45-degree angle, and that's because it allows the toothbrush bristles to reach just under the gum line, which again is a very common spot for biofilm to build up. Removing this biofilm daily is crucial because if it's left behind, it can harden and turn into calculus. Once that happens, it can't be removed by regular brushing or flossing and will require professional cleaning. So this simple adjustment in brushing technique can make a big difference. Plaque doesn't just build up on the visible surfaces of our teeth, it also collects between them in areas that toothbrush bristles simply cannot reach. That's why flossing every day is essential for thorough plaque removal. The most effective technique is something we call the C-shape flossing method. This involves gently curving the floss around each tooth and sliding it below the gum line. This method helps remove plaque and debris from those tight, hard-to-reach spaces, promoting healthier gums and overall oral health. This slide goes over the steps of the flossing technique, showing you how to clean between your teeth properly. The sulca brush is designed to clean along the gum line and in those hard-to-reach areas between the teeth. It's especially useful for individuals with bridges, crowns, implants, or gum recession, where plaque and food debris can easily build up. Its angled, pointed bristle head allows for precise cleaning in spots that a regular toothbrush might miss, making it a great tool for maintaining oral health in more complex areas of the mouth. Similar to the sulca brush, the end tuft brush features a small, compact head with tightly packed bristles, making it perfect for precision cleaning. It's especially effective around implants, crowns, bridges, and along the gum line, or essentially all areas that can be difficult to reach with the standard toothbrush. This brush is also a great option for patients with crooked teeth or open spaces where food and plaque tend to collect more easily. It's a simple tool that can make a big difference in maintaining oral health. Brushing your tongue is a key part of maintaining good oral hygiene and preventing bad breath. The surface of the tongue can trap a large amount of bacteria and food debris, which contributes to odor and overall health issues. Using a tongue brush or scraper daily helps to remove buildup, freshen breath, and support a healthier mouth. If you don't have a tongue cleaner, you can still use your regular toothbrush to gently clean your tongue as part of your daily routine. Oral hygiene coaching with limited mobility patients. Maintaining oral hygiene can be especially challenging for individuals with limited mobility, whether due to physical restrictions or reduced hand dexterity. However, consistent oral care remains essential to prevent plaque buildup, gum disease, and tooth decay. Fortunately, there are modified tools and adaptive techniques available, such as using an electric toothbrush or using floss holders. They can make daily oral care more manageable and effective for these patients. Even including like a mouth rinse can help reduce bacteria in the mouth.
I just wanted to start this slide off by explaining a common myth that a lot of people have. This myth is that dentures don't need to be cleaned because they're not real teeth. This is definitely not the case. Denture care is extremely important as it is very common among the elderly and many of your patients may have them. Cleaning dentures is crucial for maintaining oral health, systemic health, and ensuring the health of the gums and any remaining teeth. Dentures should be cleaned regularly because they can still accumulate bacteria and debris even though they're not real teeth. Regular cleaning of dentures will also maintain the integrity of the dentures by preventing stain and maintaining the fit of the dentures, as they are very expensive. If dentures are not cleaned regularly, they will accumulate food, debris, as well as plaque. This can have a negative effect on both the well-being of the dentures and the health of the tissues in the mouth. So there are two different types of dentures that you may see. The first is a complete denture, which is when the whole upper and or lower teeth are dentures, so they have none of their own teeth in their mouth. They're all made up of the dentures. The second is a partial denture, which is when there are still some remaining teeth and the rest are made up of a denture to replace the missing teeth. So when you're providing oral care to your patients, you may be expected to remove dentures if they cannot do so themselves. To remove the upper dentures, you're just going to place a finger on each side between the denture and the cheek, and then you're going to press down gently where the denture meets the gums in a rocking motion, so back and forth until the denture becomes loose. To remove the lower dentures, you're going to place your thumb and fingers on either side of the dentures and pull upwards, again using that rocking motion until they become loose. Then following denture removal, it's crucial for you to complete an oral scan, so just look around the mouth. Common findings associated with dentures is denture stomatitis, angular cheilitis, and oral candidiasis. So denture stomatitis is one of the common oral manifestations associated with dentures. It's characterized by inflammation and redness of the gums underneath the dentures. Common symptoms of this include soreness, red and white patches, and discomfort while chewing and or speaking. Treatment includes antifungal medications, denture cleanings and adjustments, and oral hygiene. So angular cheilitis is a skin condition that affects the corners of the mouth, and it's often confused with cold sores. It can be caused by dentures that just don't fit properly. The symptoms are bleeding, blisters, cracking, crusting, redness, and swelling in the corners of the mouth. And then treatment includes antibiotics, ensuring that the dentures fit properly, dietary changes, and sometimes ointments or creams. Oral candidiasis is a condition where the fungus Candida albicans builds up in the mouth. This produces slightly raised creamy white sore patches on the mouth or the surface, in the mouth or on the surface of the tongue. The common symptoms include white patches or spots located on the tongue, cheeks, roof of mouth, gum, and tonsils. Also redness, burning, soreness, and bleeding when touched. It can also cause loss of taste, irritation, and pain under the dentures. And then treatment for this includes antifungal medications. So proper oral care should be done on your patients after their dentures are removed. If the patient has no teeth, it is important to swab their mouth with gauze and biotine and or water to clean it. So just, taking a piece of gauze, soaking it in the water or biotine, and swabbing out their mouth just to clear any debris, bacteria, anything that might be left in there. If there are remaining teeth, proper oral care should be given. So this would include brushing, flossing, all that kind of stuff. To effectively clean dentures from debris and dental plaque, it's recommended to remove them at night and thoroughly brush all surfaces of the dentures to ensure all food and debris are removed, as well as any leftover adhesive if the patient uses it. After brushing, they should be soaked in an antimicrobial rinse to help ensure that no germs or bacteria remain. And then after soaking, they must be rinsed thoroughly before placing them back in the patient's mouth. Some can make them sick if they swallow too much. And it's also important to make sure to use a toothpaste that's meant for dentures and a brush that's meant for dentures so that you don't cause any issues with the dentures and you don't scratch them. When the dentures are not being soaked, it's recommended to store them in an airtight container to help prevent moisture accumulation and also just prevent anything from happening to them. After removing dentures, you should inspect them to ensure that they're not broken and that they're in good condition. If the dentures are ill-fitting, it's important to inform their patient's dentist. They should visit their dentist, as a poor fit can cause irritation to the gums and allow bacteria to accumulate between the denture and the gum tissue, which can cause many more problems.
The last topic we'd like to talk to you guys about is completing an oral scan, and this topic kind of brings everything together that we talked about and just gives you guys a better idea of what you may see in the oral cavity and what we should be documenting and what may be considered normal versus abnormal. So what is an oral scan? So an oral scan is a visual examination. It can also be tactile, and we'll go into that further later on in the presentation, of all tissues located in the oral cavity. So how we do this is we use the gloved fingers as well as a mouth mirror to inspect the gums, teeth, tongue, soft and hard palate, and cheeks. So pretty much with an oral scan, we are going in depth on everything located in the oral cavity, and we are looking for signs of anything that may be abnormal. So now, how do we complete an oral scan? So the first part of our oral scan is making sure that we have the proper PPE on. For us, that includes a gown, gloves, mask, and eye protection. I'm not too sure what that looks like for you guys, but we definitely want to make sure we have the proper PPE on. So first we're going to look at the hard palate, making sure that there's nothing abnormal. And we'll go into further what abnormal looks like and how you guys are best to detect if abnormality may be occurring. So next we're going to look at the soft palate and the tonsil area. So for this we can use a tongue depressor, and we can do the old-fashioned say ah, and we can make sure that we're not seeing any lumps, bumps, redness, anything like that. And then we're going to look underneath of the tongue and at the floor of the mouth. So get the client to raise their tongue to the roof of their mouth. And again, you're just looking for anything that may be out of the ordinary. Next is the lateral border of the tongue. So for this, we're going to take a piece of 2x2 gauze and just gently grab their tongue, and we're going to pull it to each side, looking at the lateral surface of the tongue and underneath of the tongue. This is a really important area because there's a lot of pathology that can go on the sides of the tongue. So any abnormalities there really need to be documented and referred out. Next, we're going to look at the mucosa. So for this, we're just going to gently flip the lip up, and we're going to look under the lip. We're going to look on the side of the buccal mucosa or the cheeks. Again, just anything out of the ordinary, any red or white patches, anything like that. And we're going to check the lower lip of the mucosa. So for this as well, so not only are we doing a visual exam, but we can also palpate these areas, and any big lumps or bumps can be noted in the client's chart and can be referred out if needed. I'd really encourage you guys to take a couple minutes and watch this video. This video just shows how an oral scan is completed. It is catered more towards the dental field, so there may be some terms or things that we did not talk about in there, but this just gives you a good overall view of how we complete an oral scan and kind of how we can maneuver through the tissues to get a good look at the oral cavity as a whole. So what are we looking for when we're doing our oral scans? So we are looking for obvious cracked or decayed teeth. So when a tooth is grossly decayed, you will see it in the mouth, and it will be pretty obvious when you see it. We'll go through it a little bit later what that kind of looks like. Red or white patches on the gums, cheeks, tongue, and palate. There's a lot of oral pathology that can go on in the mouth, and we do not expect you guys to be able to diagnose or to know what it is, but anything that you have a gut feeling that's abnormal, it's totally worth it to throw it in the patient's chart, ask the doctor, and then even refer to the dentist or someone else to get a good look at that. Oral cancer is really prevalent, especially in the older population, smokers, stuff like that, so we really want to be diligent in making sure that we're screening for that. We're looking for lumps and bumps of any kind, growths or swelling, any areas of mouth pain, changes in color and shape of oral tissues, and difficulty chewing and swallowing, as well as chronic sore throat, hoarseness in voice, and swelling. So one thing to look out for is this kind of relates to long-term care and just care in general, is if your patient is having difficulties eating, if they're complaining about pain while swallowing, mouth pain at all, it's really worth it to get a referral out and again, make sure we're documenting everything for them. So what is your role? So when completing an oral scan, we are looking for anything that may be out of the ordinary. We are not able to diagnose or determine if something is of concern. We are simply here to just report and document the findings. So just like you guys in the dental hygiene profession, we have lots of training and education on abnormal versus normal findings in the oral cavity, but we are not able to make a definitive diagnosis or treatment plan. So we are simply there to be proactive and see if something is of concern. Our golden rule that we follow is if the lesion is present for more than 2 weeks, we need a referral to the client's doctor. And this goes for if it's present, if it's changed in size, if it has not completely gone away within the 2 weeks, then we need to start being more proactive and referring to the client's doctor or a dentist. So that is kind of your role in the matter. So we are not expecting of you guys to know everything that's going on in the mouth. We just want to follow our gut instinct. And if we think something is not normal, we just want to bring it to the attention of someone who can kind of make a definitive diagnosis. So we will go through the following images of common conditions you will see when completing an oral scan, and hopefully it just helps you feel more comfortable completing oral scans and determining what needs attention right away. So the first thing you're likely to see is plaque and tartar. So plaque is also called biofilm, and we went over this earlier in the presentation. Again, it can be removed with toothbrushing, and that's just what it looks like there on the left. And then tartar or calculus is on the right, and it's the calcified version of the plaque biofilm, and they must come see us in order to get that removed, and you are totally able to refer to a dental hygienist if you see a client with tons of calculus and tartar, and other conditions we'll go over later in this presentation. The next thing you might see in the oral cavity is areas of decay or cavities. So obvious signs of decay appear as dark brown and black areas on the tooth. As I mentioned earlier, we are only able to see decay in the mouth when it's pretty extensive. Early decay can be detected with dental x-rays, and that's why it's so important that patients come see us regularly so that we can be proactive and we can be preventative in the advancement of decay. So these are kind of what you'll see. It's just like cratered out black or brown areas of the teeth, and it's literally just holes in the teeth, and this needs immediate referral to a dentist to get filled. They can become painful and they can get more severe, so it's really important if we see any decay that we are referring out for our patients. The next thing you may see in the oral cavity is fungal infections. So we have oral candidiasis, and this is also known as thrush. There's many reasons why this may occur: medication, certain medical conditions, poor oral hygiene, but it's characterized by that white coating on the tongue. So again, we are going to need referral either to the dentist or to the resident's doctor, and they will likely need it to be placed on antifungal medications, and we really need to be diligent with their proper oral hygiene, using a tongue brush and really debriding that area of all the bacteria. The next fungal infection you may see, especially with our older residents and patients, is denture stomatitis. So as we can see on the hard palate here, it's red, inflamed, and it's caused by pretty much bacteria sitting underneath that denture. And again, the client or patient may need antifungal medications. And if we do see this, they need to be referred to their denturist to get their denture realigned or refitted. And here we just have some more common oral lesions. So here we have linea alba, and that's the white line on the cheek or buccal mucosa, and normally it is caused by friction. We see this in our heavy clenchers and grinders, and it's just friction of the tissue that is causing that white line. Then we have our canker sores or epithelial ulcers. These are also contagious, so we want to be careful with those, and they can be really painful for the patient as well. Next we have our cold sore, and that is caused by the herpes virus, and it is also very contagious. Since it's on the outside of the lip, we want to be careful that when we are doing the patient's oral care, that we are not transferring this to other parts of the body. So we want to be very careful when they have cold sores. And then on the right here, I included this because it can be kind of shocking when you see it in the oral cavity, but this is just known as tori, and it's just a bony growth. The only way that this would cause harm is if the client's dentures are not now fitting properly because of the tori, and again, they would just need a referral to the dentist. They may need to get it removed, but yeah, typically this is a very benign condition. So next we'll talk about dental diseases. So there's two main dental diseases that we are concerned about: gingivitis and periodontitis. So gingivitis is with the gums, the gingiva, and it is inflammation of the gums only. This is reversible with proper oral hygiene and intervention from the RDH. And this is going to be characterized by the red puffy gums, bleeding, and stuff like that. And then we have periodontitis here on the right, and that is destruction of the bone and tissue. So once the bone gets eaten away by the bacteria, the bone can no longer regrow. It's not coming back, so it is an irreversible disease. And we can see this by recession. There's a lot going on there. We'll see the inflammation from the gingivitis as well as the bone loss. And again, this needs an immediate referral to an RDH to kind of figure out our options and to debride the area and figure out a treatment plan for this specific client. Just a little statement on bleeding gums. So typically, bleeding gums during eating, chewing, and toothbrushing is a sign of dental disease. Our golden rule is healthy gums should not bleed. This being said, the patients that you may encounter probably have a lot of health conditions going on. They may have certain medical conditions. They may be on certain medications. So it's not a telltale sign, but it is a sign that they should come visit us at the dental office to kind of figure out what's going on. So when you're completing their oral hygiene and you see that their gums are bleeding, or if they're eating and they're complaining that their gums are bleeding, please refer them to us, and we'd be more than happy to assess them and see what's going on. Oral cancer is a huge part of why we complete the oral scans. It can manifest in many different ways in the mouth. And as you can see from the photos here, it typically is like a lesion that looks pretty scary. So if you see any of these, if you see anything that is just not sitting right with you, please refer, document, and report oral cancer is so prevalent, and I know with most residents, especially long-term care, sometimes it can be hard for them to come visit us. So we really need your help to detect oral cancer early. And it can just even take a few seconds of just quickly looking in the mouth. Something like oral cancer is going to jump out at you, hopefully pretty easily, and then like I said, we can refer, document, and report our findings in hopes of catching oral cancer early. So just a final note on why we do oral scans. So pretty much in summary, it is used to assess the condition of the oral cavity, and by doing this we are able to detect oral cancer, we are able to prevent or slow the progression of dental diseases, and ultimately ensure our patients' oral health needs are being met. And just a reminder that your patients are often not seeking dental care regularly, so we really need your help to be able to detect any issues that could be going on in the oral cavity earlier. And I think we should be working as an interprofessional team and working with one another to be able to provide the best care for patients that we can. So I hope this helps you feel a little more comfortable completing an oral scan on one of your patients. And thank you for listening to my part of the presentation.